to demonstrate the location of these structures and how to study. So I would recommend beginning with APR and opening to the skeletal module along with the dissection tool. Just again, as a reminder, we are looking at regions here of the appendicular skeleton, which I've highlighted here in green. There's a second or a previous video which covers the role and the structures of the pectoral girdle along with the upper limbs. In this video, we will be focusing on what is known as the pelvic girdle and its attachment to the lower limbs. The pelvic girdle begins with what we would also call the hip bone. So the hip bone themselves are going to be different morphologically between female and male. So if we take a look right here at the female pelvis, you'll see a number of things. You can see right here what's called the pubic angle is pretty wide. The pelvic girdle seems to be pretty wide and pretty squared off. However, when we look at the male pelvic girdle, right there, right, there we go. There's our male pelvic girdle. It's a little more elongated from top to bottom and a little more narrow. And this pubic angle right there tends to be a little bit more narrow as well. One other structure you want to focus on when you're looking here at this pelvic girdle is going to be referred to as the pelvic inlet. So in order to show that pretty well, we're going to go back here to the main list and highlight pelvis. We're going to look here at the hip bone and features. And we're going to begin with what's called the pelvic inlet right there. So there's your pelvic inlet. It's essentially going to be this ring that opens into the lower area of the pelvis. Another view right here giving you that anterior view shows you the difference between what's superior and what's inferior to the pelvic inlet. In your lab manual, you'll see what a region known as the greater or the false pelvis. That's everything above the pelvic inlet. And then the lesser or the true pelvis is everything below this space right here. When you look at the pelvis itself, the pelvis is going to be formed by 3 different bones. So we're going to take a look here at what is known as the ilium. I'll go find the ilium on the list. And this ilium right over there forms the bulk of each one of the coxal or the hip bones. You're also going to see what's called the ischium, which tends to form the more posterior region. And then finally the pubis. Right? So the best view for studying this is actually going to be the lateral view right here. So in this image, you're actually looking at the right hip or coxal bone, and you're looking here at a lateral view versus a medial view. One of the most outstanding structures is known as the acetabulum. The acetabulum is going to be this little hole or this pocket, and it is lateral. That acetabulum is a unique structure. While there are 3 bones, the ilium, the ischium, and the pubis, the acetabulum is formed by all 3. So this is one bone marking that you will not refer to as a part of a bone. Likewise, a structure known as the obturator foramen is going to be a part of, there we go, it's going to be a part of both the pubis and the ischium. So pubis and ischium, and likewise will not be referred to as a bone marking of a particular bone. Just refer to it as the obturator foramen. We'll begin by studying the ilium, since it is the larger of the structures. Right there. When you begin to study the ilium, you should start with a structure called the greater sciatic notch. That's this notch right here. It is going to be posterior, and you can see it from both the lateral and the medial views. From that greater sciatic notch, once you know that you're looking at the posterior side, you can then look at these 2 bony prominences that sit right above it. These are going to be referred to as the posterior inferior iliac spine and the posterior superior iliac spine. On the opposite side, you see 2 spines that mirror that. Since they're on the anterior surface of the ilium, those are referred to as anterior superior iliac spine and anterior inferior iliac spine. Another region right over here called the auricular surface of the ilium is a big rough spot. So again, this will be a great landmarker. This is a medial side of the ilium itself. If I go back to a view right there and show you where the ilium actually articulates with the sacrum, then that auricular surface is right here. And it's right where you'll see articulation with the auricular surface of the sacrum. So they do have the same name. So when we move down to the ischium has some very similar structures to what we saw with the ilium. So to begin with, there is a notch, but it is smaller. It's called the lesser sciatic notch. You can see a better view of it here in the medial region. And above it and below it will be two protuberances or spines. The one above it is referred to as the ischial spine. And then below it is called the ischial tuberosity. When you sit down, this is what bears the majority of your weight. Finally, you end with the pubis. The pubis itself is going to actually be a location where the two hip bones join. So we'll take a look at another view right here so you can actually see where that takes place. We'll go to the anterior view. And everything highlighted in green right there is the pubis. So to begin with, you have what's called the pubic symphysis. Oh, I don't have it on this view. Let's go back to a different view. Right here. Let's see, there he is. Pubic symphysis highlighted right there. This is actually going to be a fibrocartilage structure that joins the two. And then the two ridges here of the pubic bone are named based on their location. So you're going to see, oh, where did they go? The pubic crest leading right into what's going to be known as the superior pubic ramus, which I don't see on this particular list. We'll go back to this structure right over here. Superior pubic ramus right there leading up to the top, and then the inferior pubic ramus leading to the lower region. There you go. Right there. Inferior pubic ramus. Again, showing you where that sits. Inferior and then superior right up here, coming together to join at this pubic symphysis. So when we go back here and we look one more time at the acetabulum. This is important because as we begin to look at the lower limb, we see the acetabulum is where the lower limb actually articulates with the hip. So right here you can see it. And then in the male you can see it's a little harder to see because of that more tall and narrow appearance of the male pelvis. So we'll come back up here and we're going to choose a different topic. We're going to look here at the leg and the foot. And we're going to start with the anterior view for these. And we are going to move up to the femur itself to show where it actually articulates right here. So there's the femur, and you can see it's the longest and the strongest bone of the body, and it articulates right there with the acetabulum of the hip bone. We'll go back so that we can study the femur on its own. So we're looking here at the anterior and the posterior view of the femur. And this is going to be of the right femur. Like the humerus, the femur is going to have a smooth head where it articulates with the acetabulum. It's going to have a neck, and it's going to have a series of processes near the neck. With the humerus, they were called your tubercles in here, or the tuberosities, and this is going to be called a trochanter instead. So this is the greater trochanter, and then back here you can actually see the lesser trochanter. You can see it peeking out right there from the anterior view. In between the two, you have what's called the intertrochanteric line, and that's going to be similar to that intertubercular sulcus that we saw in the humerus. The shaft of the femur itself is going to be very long, and it's going to lead down to a region of the femur that actually articulates with three bones, or two bones. The first right here is going to articulate with the patella, and then of course you can see what's called the medial condyle and the lateral condyle, both of which are going to be responsible for articulating here with the tibia, which is below it. Now I will note that the condyles here will have the same names on the tibia. So this would be the lateral condyle of the femur, this would be the lateral condyle of the tibia. So it makes it a little bit easier for you when you're studying this. The region between those two condyles is called the intercondylar fossa, and then right above it is the popliteal surface. So you've got your directional terms helping you with patellar and popliteal. These should sound like review as you go through this. A few other structures you'll see on the femur. On the posterior side is a long line called the linea aspera, and this is going to be for attachment of some of those hamstrings muscles that we'll learn about very soon. Followed by, right above each condyle, what's called the medial epicondyle and the lateral epicondyle of the femur itself. So that's the femur. We'll move on then to the lower part of the limb. We're going to look at your tibia and fibula. So the tibia and the fibula have names that sound very similar. Be sure not to confuse them. The tibia itself looks almost like a letter T with a broad top and a narrow base. And the fibula is a much skinnier, lighter weight bone. I've often said that a fib is a little white lie, so the fibula is the little white bone in the lower leg. To begin with, we're going to study right here the anterior surface of the tibia. With the tibia, I said that these structures would be named the same as what they were in the femur. This is your lateral condyle of the tibia, the medial condyle of the tibia, and then what's called the intercondylar eminence. It projects upward instead of caving inwards like the intercondylar fossa of the femur was going to do. When you scroll to the very front right here, you have what's called the tibial tuberosity. Again, this is going to be attachment for muscles, but now we're looking at quads muscles since this is the anterior part of the leg itself, followed by the anterior crest, also known as the anterior border of the tibia. If you take your hand and you run it around your ankle, you're going to find that on the lateral and the medial surface of your ankle are two large bumps or protrusions, one of which is this medial malleolus. So if you've got the thumb on the inside of your ankle, that large bump comes right here from the tibia. Now, it does have the same name as what you see on the lateral side. This would be the lateral malleolus. However, this comes from a separate bone. The lateral malleolus is a part of the fibula. So we're going to turn our attention here to the fibula. Not much for you to learn right here. The lateral malleolus is going to be the more distal end, while the head is going to be the more proximal end of the tibia. Of the fibula right here. So this is very similar to our discussion of the arm. The forearm limbs led to the wrist. Well, since we're looking at the lower part of the leg or the crural leg, this is going to lead us to the ankle. And so we are going to move right here in this part of the list down to ankle and foot. Right there. So you can see the superior view and the inferior view here of the ankle. And the ankle is going to be formed by what are called carpals. And the carpals themselves, I apologize, the tarsals. The tarsals themselves are going to be numerous, most of them relatively small like we saw with the carpals of the wrist. However, you have two that are quite large. The first one that you're going to see is called the talus. The talus tends to be the most proximal, and you can see it right here articulating with the fibula and the tibia. And then below that is going to be the calcaneus, arguably the most well-known of the bones. That's the largest. It's going to bear the most amount of weight in the back part of the foot. Here from the inferior view, you can see how it stretches all the way across almost half of the foot. So that's the calcaneus. As the bones move closer towards the toes, you're going to see they get a little bit smaller. So you'll see right here what's known as the navicular, more medial, and the cuboid, more lateral. And a series of these three bones right here are called cuneiforms. They're going to be named the medial and the lateral cuneiform with the intermediate cuneiform right in between. That ends the discussion of tarsals, leading right then to the metatarsals. So very similar to what we saw in the hand, these metatarsals themselves will form the arch of the foot and will be named by the number that is associated with the digit that they run along. So here, this would be digit 1. So this would be metatarsal 1. Metatarsal 2 aligns with digit 2, so forth and so on. 4 and 5. Remember that there's only one metatarsal per digit. And then, of course, that leads into the phalanges. These phalanges are going to bear the same kind of a pattern that the phalanges of your hand did. So notice that the hallux, or the toe, only has 2 phalanges, while digits 2 through 5 have 3. Those phalanges, which are closest to the metatarsals, will be known as the proximal phalanges. And those that are furthest will be called the distal phalanges. For digits 2 through 5, there is an intermediate phalanx known as the middle phalanx. So these are your middle phalanges. Keep in mind that when naming the phalanges, you should again address which digit it is a part of. So for example, if we look at this digit right here, I apologize. When we look at the proximal phalanges, this will be the proximal phalanx 1 or proximal phalanx of digit 1. So be sure to name them accordingly. That ends our discussion of the appendicular skeleton with the pelvic girdle and the in the lower limbs. If you haven't already watched the video that covers the pectoral girdle with the upper limbs, be sure to do so now.